is a multi-group dental practice that operates in multiple states here in the United States. Kool Smiles is providing care for underserved communities, but we're doing it in a very, very high quality way.
People speak about our mission, our vision, and they don't quite maybe realize that there's a deeper meaning to the mission and the vision that we have. It comes from a very deep-rooted history, a very specific history. The vision very much comes from the fact that we come from the same community, the same demographic as our current patients.
I was born in India. We came here with, my parents will say, $17 in their pocket, literally nothing. And so basically dental care was not a priority in our life. The moment that we got to see a dentist was when we got commercial insurance through my mom's job. I was probably around 12.
My dad was my biggest influence in the decisions that I made in my life. My dad's practice early on was in family medicine. He opened a practice in the heart of Murfreesboro, Tennessee, which was directly in the underserved areas. I just remember seeing patients coming in, bent over, barely walking into that office. Oftentimes they did not have the ability to pay, but my dad would not turn away patients if they were in need. And so if they didn't have the ability to pay in cash, oftentimes they would bring fruits and vegetables. I remember even one time a lady brought 2 pans of cornbread that she had made herself fresh out of the oven, and my dad accepted it.
When I finished dental school, there was still a draft. I was in the Navy in what they called an early commission program, which meant that upon graduation, within 2 or 3 days, I was on active duty working on recruits that were being trained to go to Vietnam.
I was born in Vietnam, the youngest of 7 children. Came to America when I was 2 years old, right after the war ended in 1975. It quickly became tough. My father died when I was 12. My mom was left to raise the 7 of us, and we quickly learned that life was a little tougher than what we had imagined when we first thought we were coming to America for a better life. One of the things growing up, I remember when I was 6 years old having a toothache. Mom took me to the community health center. You literally take a number and you'd wait. When I got in there, people were nice, the staff was friendly. The dentist was scary, but he pulled my tooth and made me feel almost immediately better. When I was done, I was so thankful that I had gone and had that work done. As I got older, I realized to myself that although that was a good situation for me, and I was very thankful to have had a chance to have some access, I also realized that the environment, the situation, the care could have been more personalized. When I decided to become a dentist, I said to myself that that's the kind of atmosphere that I'd like to have for my patients.
I've been a trustee for the American Academy of Pediatric Dentistry. I've been a board examiner for the American Board of Pediatric Dentistry. I've had some experience where I have been a consultant for Medicaid practices. I had retired. I was sitting here doing nothing, and so I thought, I gotta find something else to do. I can only ride my motorcycle so much. I was contacted by an individual to see if I would help them. They were interested in buying a dental company, and they said my name had been given to them, and would I be willing to help them assess the quality of treatment by this outfit. Unfortunately, I came back and said I didn't think that they were the kind of outfit they wanted to invest in. I thought they were over-treating and doing what, in my mind, amounted to Medicaid fraud. About 2 months later, they called me and said, we found this other group of clinics in Atlanta, Georgia. Would you be willing to go down there and look and see what you see? Like I said in my report to them, this was like a diamond in the rough. They were very, very good. They had good records. They had a good record-keeping system. And so I said, you might be interested in pursuing this. They said, thank you very much. And another 2 months went by, and they called me back and said, we'd like you to be our chief dental officer. That was Kool Smiles.
The the practice I initially worked at, there's always this void, as if there was a vast majority of people out there that nobody is willing to see. I ended up meeting Dr. Earl. What she did was she just really talked from her heart. She talked about the company, she talked about the mission. Her focus was not about the numbers, it was not about my production. She wanted to learn about me, my compassion, the kids, and that is what attracted me to the company. In dental school, we were starting up something called Operation Smile Dental Mission to Vietnam. And we saw kids with their, front teeth bombed out, back teeth bombed out. And here I am, and I'm seeing similar things. These kids come in with rampant decay. They come in with cavities all over that you can just sit there and say, oh my goodness, this should have been treated about a year ago. This should have been treated a couple years ago.
There are so many patients out there that don't currently receive access to care simply because there are not enough dentists that are willing to take Medicaid and other insurances. Just because you grow up in a poor neighborhood doesn't mean that you should take a second seat to anybody else.
A patient is a patient, and they come to us with needs that are all the same. There should be no distinguishing when it comes to care for patients. If a patient is treated differently than another just because of their payer source, that in fact is against what we've been taught all through dental school.
We have never turned down any patient for not being able to pay.
Kool Smiles last year probably gave away around $15 million in services for patients who did not have the ability to pay.
We saw more than 2 million patients last year. Those 2 million patients would not have found care had there not been a Kool Smiles in existence. There's a great need to help these people. It's a professional responsibility, at least in my mind, to take care of these children. When I first joined the company, I made sure that they adopted the treatment guidelines of the American Academy of Pediatric Dentistry and the American Dental Association so that our dentists would know that these are the things that we look at to make sure you're following very closely. And it's also the things to which we train our dentists when they come into our system.
We've invested millions of dollars in our compliance program.
We had a very brilliant programmer that helped us write our own electronic record system. I can sit right here in Minnesota and in real time either advise a dentist of treatment that needs to be done, but also review charts and do the type of things so that we're sure that what we're doing is in keeping with professional standards. I think it's the thing that sets Kool Smiles apart. I don't know of a single clinic system in the country that has a sophisticated quality assurance program.
I feel like we have found an impeccable group of people that really care for the kids. Their drive to really take care of the access issue, to ensure that we have quality dentists working with these kids, and all of our focus to have efficiencies correct, to have the support correct. I just feel very, very good to have found an organization that aligns with the same integrity and values that I have.
Although we've come a long way and we're treating so many more patients that never received care before, I feel like we have a long ways to go. We need to keep being diligent and keep doing what we're doing to be able to impact it as best we can.